Hello, I'm the Employee Wellness Coach for the City of McAllen. My name is Rafael Curiel. In this webinar, I'm joined by DHR Endocrinologist Dr. Melany Castillo and DHR Wellness Director Elizabeth Herrera on the topic of diabetes. You know, education goes a long way in helping you know that the choices that you're making today are the right ones for your health. Let's give a listen to Dr. Castillo as she explains the conditions, medications, and the best way to prevent diabetes.
So again, thank you so much for this opportunity. My name is Melany Castillo. I'm the endocrinology here at the Diabetes and Endocrinology Institute at DHR Health. And I'm very pleased to be with you guys, teaching you a little bit about diabetes and the importance about making aware of this disease that is affecting the whole entire planet, especially here in the here in the United States and here in the Rio Grande Valley. So what is diabetes? So diabetes is a disease that is characterized by the fact that we cannot metabolize very well glucose, and it could be because we don't produce enough insulin, or the insulin that we produce, we're not able to utilize it the way that it should, making our blood sugars rise in our blood. So diabetes is definitely one of the most costly disease here in the United States. Yesterday when I was updating my slides, I was looking for the cause of this disease, and we know now that it costs around $295.6 billion per year to treat patients with diabetes here. We know that 1 in every 3 visits to the primary care physicians are related with diabetes. 25% of the total healthcare cost goes to this disease, and 1 in every $5 we spend a day in medication, medicine, and cost of health goes to diabetes. So definitely it's a very expensive disease. So before, when I started doing my presentations on diabetes, the prevalence of diabetes, it was like 9.3%. Recently, this year, we have new statistic data, and it shows now that 11% of the population of the United States have diabetes. That's roughly 1 in every 10 people. We know that the prevalence also of gestational diabetes is in the rise. That's the diabetes that you get when you're pregnant, and it's around 9.2%. And if we keep going in the way that we're going, we know that in the year 2015, 1 in every 3 people are going to be diabetic here in the United States. And what we know now is that 1 in every 3 Americans have prediabetes, and 84% of them are completely unaware of it. So very scary. So we know that medicine might be winning the battle of glucose control, but it's losing the war against diabetes. And why so? Because we have so many good medications coming out from diabetes. And even though we have so many good medications, we still have more and more cases of diabetes in our community. So again, a little bit scary. So what are the risk factors for diabetes? So in this graphic, I summarize most of them. So we know that if you smoke, you have 37% more of getting diabetes. If you're overweight, you're going to get diabetes if you don't change, if you don't lose weight. We know if you have the very bad cholesterol, which is the LDL, or the good, which if you have very high LDL, or if you have very low HDL, which is the good cholesterol, you're going to get diabetes. You have more risk. If you have any, if you're very, if you're not active physically, so that means if you don't do at least 30 minutes of exercise 5 times a week, you can get diabetes. Here in the Valley, one major risk is that or Hispanic heritage. So if we're Hispanic, especially Mexican heritage, you are most likely to get diabetes. If you have gestational diabetes, if you had that type of diabetes that you get when you're pregnant, you have a 50% chance that you will become diabetic. So that is very important. If you had it, make sure that you can follow up with your doctor so they can check. And of course, very few people really get their sugar under control once they have diabetes. So what happens when we eat sugar? So that's the main problem to our brain. So when we eat sugar, our brain really, really likes sugar. And then Our numbers, our blood sugars start rising in the blood, and that sends a signal to our insulin production. So insulin goes up, then our sugars start going down, and then our brain senses that and make us feel hungry, and then we start eating again. And I always like to use the example of like when we eat a piece of cake. So we eat a piece of cake, you eat it, and then in 2 hours, you're ready to eat another one because the sugar gets absorbed so fast that your brain is sensing, oh my God, my sugar's going down. I'm just going to feel again hungry, so he can start eating again. And that is like a vicious cycle because the more we eat, the more weight we gain, the more insulin we need. So pretty scary. So what happened when normal people eat sugar? So even if when we eat sugar, our brain sends the signal, the pancreas knows, the pancreas, which is the organ that produces insulin, gets that signal, produces insulin, and then it will bring your blood sugars down to normal. So the insulin, I always like to use this little cartoon right here. Imagine insulin as being like the key that opens the door so the sugar can go inside the cell and give energy to the cell to make its work. In this graph, I really like to show people, I don't know if you can see my arrow right here, but if you see in the upper portion, in the upper portion of the cartoon, you see the levels of sugar in normal people that don't have diabetes. So even though you eat in the bottom line, in the bottom part of the graphic, you can see insulin secretion. So when we eat breakfast, lunch, and dinner or supper, or insulin goes up with each meal, but our sugar maintains a very stable line. But that's not really the case on people that have diabetes. They would have very high peak of sugar after each meal. So what happened with all this sugar, which is when the sugar is very high in our body, which is called hyperglycemia, and it's just that sugar is just piling up in our blood. It's just staying there in our blood. So in this graphic right here, you can see the little yellow dots, like normal sugar. But when we have low sugar in our body, you see very little of those. And then if you see in hyperglycemia, there's tons of sugar there just floating around your body. So when do that happen? Number one, you ate too much sugar and your body was not able to produce enough insulin to bring that blood sugar inside the cells, or you produce a bunch of insulin, but that insulin just doesn't work. So the sugar just stays in your body, in your blood, and that's when it goes to your cells and produces all that damage that we know. So why is it that we love so much sugar? So I like this study that they did with, it's a PET scan of the brain, and they did it on people that had like used cocaine. And if you see in the areas of the brain that are in charge of pleasure, it lights up. But when you eat sugar, it pretty much lights up in the same areas and even brighter. So I was reading about that a little bit, and what happened is that we know that people that indulge in sugar, they have a hard time then saying no to more sugar coming up. And that has to be with dopamine in our brain. So that's why the more sugar you eat, the more you want. And it's hard because when you want to say to your brain, hey, stop eating sugar, if you're just always nourishing these cells that just want more and more pleasure, you're not going to be able to say no. And then also the way our body functions, where we are under the effect of sugar, like when we are under the effect of cocaine, it would impair the way that our brain functions. And the study was done also in rats. So they give them a bunch of sugar, and they put these rats to do certain tasks, and they were unable to do it in the same way as rats that have their regular diet. So pretty interesting. So how much sugar is in that drink? And just to give you an example, because people say, but I just have one little soda a day. So I just got this from looking at the internet, and it was very educational to see, like, if we eat just one bottle of this Lipton, which I see a lot of people drinking around, it's like you ate 12 Hershey's Kisses. So imagine how much sugar. So what happened with Arizona, which is just green tea, and we said it's just green tea. 20 Hershey's Kisses. So a lot of sugar. What happened when we drink this 100% apple juice, and we said that this is so healthy for our kids? You just give them 10 Oreo cookies. So it's like a lot. And just not even talk about soda, Coca-Cola, which is terrible. And I always call it poison. That's how my kids call it, because it's really poison. Imagine you're putting all that sugar just in one. And I see people that can drink like 5 of them. So pretty scary. So once we get into that point, let me see here. I'm sorry. Let me see, because I wanted to see what are the symptoms of diabetes. So what happened when you start building up this sugar in your body? So a lot of people, and I think more people know about it because of what we see in the TV and advertisers, definitely you start feeling very thirsty. And why you feel very thirsty? Because you start increasing the amount of urine that you produce, because all this sugar is being drained to the urine. So people start urinating tons, and then they drink a lot of water. You can start having blurry vision. You can start having tingling in your hands and your feet. You can feel hungry. You can have like a headache. And when you get to the extreme of it, you can start having weight loss. So when someone presents with weight loss because they have uncontrolled diabetes, it's like very bad. That means that your body is trying to get energy from other sources instead of carbohydrates, and start like eating your own fat to try to get it. So that's when people get very much in trouble. So how is the diagnosis done? So sometimes if you check random, your blood sugar is more than 200. Unfortunately, you are diabetic. We have to double check it with like lab work. But if you have more than 200, you're diabetic. If we do your lab work in the morning fasting and your blood sugar is more than 126, you are diabetic. Or if we do something called glycosylated hemoglobin, which is what we do is we check how much sugar gets attached to your red blood cells. And then that will give us an idea how's your blood sugar been for the past 3 months. If that number surpasses the 6.5 range, that means that you are diabetic. So that's how we diagnose diabetes. So, but once we have diabetes, not everything is lost. We have treatment for it. If we are in the early stages, we can reverse it with a good diet, with exercise. So what are the aims of management of diabetes? First, to achieve a near normal glycemia, to short-term and decrease and prevent symptoms of hyper or hypoglycemia. We want in the long term to prevent complications and to make sure that we can have a good quality of life or near normal life expectancy, because once we have diabetes, we know that our life expectancy shortens. So that's why we wanted to try to prevent. Okay, very good. So I wanted to talk about a little bit about the medications that we have, and then where do they act? Because a lot of people are seeing these advertisers about medications of diabetes and how they work. And I think that here in the Valley, at least we have a family member with diabetes, or someone very close to our house has diabetes. So these names pop up very frequent. So I wanted to share a little bit about the medication. So we have different types of medications, and they work in different areas in the body. And so right here in the liver, so we know that patients with our liver has the function of produce sugar when we are not eating, or we are in a case of like urgency, or there's a stress to our body, the liver is in charge of producing sugar. But what happened is that in patients in diabetes, the liver produces a lot of sugar in times that we don't need it. So we have medications that will work there. We have medications that will work in the pancreas to make sure that the pancreas produces more insulin in the time that we need it. Some of the newer medications, what they do is that they make sure that we urinate more sugar, so that way the levels in the blood can go down. There are other medications that are in charge of making sure that our muscles grab that sugar, utilizes that sugar in a better way. And the other thing is some medications, what we'll do, will block the absorption of sugar in the gut, or will bring other hormones that are important in the metabolism of glucose. So what are medications we have? So we have some medications that have been in the market for many years, sulfonylureas. We have like glyburide, glipizide, glimepiride. A lot of people are taking those medications. They're very good. What they do is they make the pancreas, squeeze the pancreas to make sure that it produces more insulin, but it comes with side effects. So one side effect is the weight gain. That's something that we don't want already in our patients that are overweight. And it can come with hypoglycemia. But the good side of the medications is that are very cheap, very, very cheap, because they're been in the market for many years. So they're very good, and they're very effective in bringing your blood sugar down. And they're taken by mouth, since a lot of patients are scared of needles, so there's benefits on that. There are medications that bionites. They are the best example for this one is metformin, that everybody hears about metformin. And metformin is a great medication because it's been in the market for 50 years. And it does not give you cancer. I know that there's been a lot of recalls, and a lot of people are calling here desperate because metformin will give me cancer. I heard it in the news. But what happened is that metformin, since metformin is very cheap also, and we get it from different countries. And what happened is that some lots of metformin from a pharmacy that I think it was in Bangladesh it was contaminated with something that can give you cancer. So that's why it was a recall. But metformin is very good, and it acts in different parts of the body. It would act in the liver, making sure that your liver doesn't produce sugar when it shouldn't. And it will help your body and your muscles capture that sugar in a better way. And it's so good that we even give it to pregnant women who have gestational diabetes. So the downside of the medication is that people that don't tolerate it usually get gastrointestinal symptoms such as nausea, vomiting, and a very, very bad diarrhea. So if they get it, we just don't use it, and we move forward to another medications. The thiazolidinediones are another type of medications. The one that is more known is Actos. This one has been in the market also for many years. It's a good medication. It has a low cost. And then another thing important is that it will help your pancreas produce insulin. And it also increases your good cholesterol. But the side effects of this medication, again, is some weight gain. You can have also swelling of your body. And you can have also low blood sugars. This is a medication that will block, it's called acarbose, and it will block the absorption of sugar through your gut. And this has been in the market for many years, but we don't use it because of the side effects. It will give you like abdominal pain, a lot of flatulence, nausea. So really this one, I don't use it because of it. And we are moving to one of the new ones, which a lot of people have heard about it, like Januvia, Onglyza, Trajenta. These medications, they're very good medications. So what they do is that in our body we have a hormone that is produced in the gut, and what it does, it helps us first tell our brain not to eat when we like make sure that we get the satiety effect faster, so we don't eat so much. It also tells our pancreas to produce insulin only when we eat. And that specific type of hormone can help us with weight loss. So what this medication does is make sure that that hormone that is produced in our body stays a little bit longer, because it has a very short time. It only lasts in the body 2 minutes. So this one makes sure that whatever is produced, it just stays a little bit longer. It's very good because it has very little side effects. It's not so potent in bringing your blood sugar down, but it's a great complement. And for those patients that are just starting to have diabetes and have developed diarrhea, With metformin, this is another great option. So it's a little bit more expensive, but it's a very good medication. And this is one of the new ones. It's called Farxiga, and this is a very, very good medication because what it does, it just uses your own kidneys to make sure that you clear more sugar throughout the urine, I'm sorry, and then it will help you lose weight. So it's pretty good. It's a little expensive, has some side effects because the way that it acts, it can give you a very, very bad yeast infection and urinary infection. And on top of that, if you take that, because with sugar, it will come up more water, it doesn't necessarily mean that you're going to be urinating more, but definitely can give you a very bad dehydration to the point that you end up in the hospital. But it's excellent. It will help you lose weight. It brings your A1C down by a lot, and it's only once a day. So it's a great medication. So now we move a little bit to the injectables, which is another area. So this is the hormone that I was talking about, the GLP-1, excellent medication, great with weight loss. So for those patients that are obese and they know that every single medication that was out there was just making them gain weight, which is one of the major complaints that the patients with diabetes have, this is a great thing that came out. And what it does is excellent because it makes you tells your brain, hey, don't need more, I have enough. It makes you feel full faster. It makes you also control very well your blood sugar. It also tells your pancreas to produce insulin only when you need it, and is excellent bringing down your blood sugar. So it's very good medication. Side effects, definitely the first week you can get like a little nauseated because the way that it acts. I always tell my patients you're going to feel like pregnant, but it's going to be just for 1 week. So bear with it. And usually goes away after 1 week. There's patients that they definitely don't tolerate it, but most of them do. And the only downside is that it's very, very expensive. A lot of insurance, it is covered by a lot of insurance, but it's still very expensive. However, we are very lucky here in the Valley because we have our neighbor next door, Mexico, and then we can get all these medications there for like 10% of what they cost here. So it's always a blessing to be so close to our neighbors. They are good neighbors. So one more thing to like them and love them. Bueno, very good. So we have the medications. Some of the ones that are more known or they're always in the advertiser is Victoza, which is a daily injection. There's another one called Bayera. And we have the new ones, which is very good because it's only once a week. So we have Ozempic, Bydureon, Trulicity, and they're excellent medications. I think very few people cannot get it. Like if you have history of pancreatitis or family history of pancreatic cancer, you should not be taking it. We also have insulin, which is usually the natural history of diabetes is after many years of being diabetic or pancreas just decreases the amount of insulin that produces. So we end up using insulin at the end. So we want to try to mimic what the pancreas does. So every time that when we are not eating, the pancreas is always giving you a little bit of insulin. So that's like a long-acting insulin. And when we eat, we get very like shots of insulin very fast to help with that. So if you see, we have insulin, rapid-acting insulin, and a lot of people have it like Novolog, Humalog, and then it can come in a vial. And we have the long-acting insulin like Lantus, Toujeo, Tresiba, which are the new ones. And this cartoon right here is to show you, again, how the blood sugar behaves in a patient with diabetes. So you can see here the rise in the blood sugar every time that you eat, your breakfast, lunch, and dinner. And in the blue one, you see what we really recommend to happen. We know it will go up, but we just don't want those super high peaks that you see there. And the optimal pues is to be like a person without diabetes, which is the black line in the bottom. So right here, that's why we try to mimic what the pancreas does. So we use a once a day long-acting insulin, and every time that we eat, we use a rapid-acting insulin. So the goal of treatment, like I said, is just to try to make sure that we behave like a normal person without diabetes. This is the effect of blood sugar when you eat. So when you have carbohydrates, you spike right away. When you eat proteins, your blood sugar doesn't go up. And when you eat fat, your blood sugar stay completely normal. So that's when people tell me, "Ay, doctor, but it's just I eat a little cake like this, and I don't know why my sugar spike." That's why I tell them, like, if you are hungry, go and eat a chicharrones, so something like that, because it's just pure fat, and then your sugar will stay high. We have to become very creative and knowledgeable about what food will bring your blood sugar up and what no. So if you eat a little bit of fat, it's not so bad. It's better than eating a bunch of carbohydrates. Okay. So very good. And we always try to avoid this roller coaster with our patients with diabetes, because they go super high and then super low. And every time you're up and low, you can feel very bad. So there are different places that we will administer the insulin. Always it's just the areas where you see the little fat tissue there. You can inject. You have to rotate. This is what we try to avoid when we inject in a single place the whole time. This is called lipodystrophy, and you can see those horrible holes right there. Or you can have areas of your skin that just protrude. They just go like that out. So, but not every insulin is just injections, and this is a fantastic medication, because a lot of people are afraid of needles, and it's time consuming to get the needle out of the you inject the brain, clean the area. So for that, we have the inhaled insulin, which I love, because it's very convenient. It's just this little thing that you can carry with you every time that you eat. You pop out, you inhale, and that's it. You give yourself insulin. You can do it 3 times a day. You can take it with you. You can even do it in front of people instead of just going to the bathroom and injecting the insulin. So it's very convenient. Few people cannot use it. If you have history of asthma, any pulmonary problem, unfortunately, you are not a good candidate for this. But if not, this is something that you can ask. Usually this is handled by us specialists, because internal medicine, they're not, or primary care physicians, they're not trained on this, but we usually do it because it's a little bit different the way that we adjust the dose, but it's fantastic. Very little, it comes in different units, so you have the cartilage are very tiny, and you can change it based on the amount of insulin that you need. And downside, the cost, and that some insurance, they don't cover it. I don't know. I don't think this one, our neighbor has it. So, but it's something that you can always ask if you have a specialist on diabetes. So with diabetes, it's a team approach. I didn't touch about nutrition, but diabetes, 90% is what we eat. So nutrition is the best way to go. Instead of using all this medication, if you just cut the amount of carbohydrates that you eat, you are not going to become diabetic. If you are diabetic, you're not going to be using all these medications, and or the doses that you're using are not so high. You need to learn as much as you can, because I always tell my patients, I'm your coach. I'm just cheering for you and telling them, do this exercise and that exercise. But at the end, you are the one who takes the decision. What are you going to do?